Hello and welcome to a special collaborative episode with Social Media Docs, SoMeDocs, and Daily Remedy called Stigmatized, where we discuss the stigmatizing aspects of healthcare. Today we're joined with Dr. Tom Reach, a prolific addiction medicine specialist out of the state of Tennessee, who did much in his state to advance addiction medicine, culminating in a reduction in overdose deaths under his tutelage. Unfortunately, he found himself as the crosshairs of misguided DEA policies and suffered his wrath as a result. And with that, I'd like to welcome Dr. Reach.
Thank you very much. Good to be here.
Thank you for joining us, Dr. Reach. Now, when I say you are an addiction medicine specialist, I don't think that quite justifies the impact that you've had at a state level in Tennessee. Would you mind, before we begin the conversation, to discuss your background and some of the policy work that you've done throughout the state?
Well, I'll briefly go way back. I was an emergency physician for over 20 years in Southwest Virginia and East Tennessee, and I fell victim to the disease of addiction. I'm now a person in long-term recovery with over 22 years in the program. I had to return and retrain in the field of family medicine, and during that training, I was introduced to the use of Suboxone buprenorphine products for the management of opiate use disorder. And that was my primary substance of abuse. And I can say now I've been clean for over 22 years. But I dedicated my life and my career to trying to help people with opiate use disorder. So in 2010, I opened a small practice in Johnson City, Tennessee, with just me and my wife and another person. And within 3 years, we had 12 facilities in 4 states with 40 doctors working for us and 2,500 patients. And I became a political activist for people with addictive disorders. That involved going to the state of Tennessee, and they were trying to pass legislation requiring a certificate of need for anyone who wrote Suboxone. This was back in 2010. And we had to defeat that measure, which took a lot of time at Legislative Plaza. And then we advocated openly for Tennessee Medicaid, TennCare, to be paying for and taking care of people with addictive disorders. And they were very resistant to that in the beginning. In fact, they wanted to restrict and cut down the amount of medication that would be received. So we advocated that. And I ended up on the buprenorphine guidelines committee for the state of Tennessee. I was on the buprenorphine guidelines for on the governor's commission in Virginia. And I helped write legislation nationally with the ASAM legislative committee. I am board certified in addiction medicine and have been an open activist for getting people treated who have substance use disorder.
Wow. So, from overcoming your own substance dependency to becoming a political activist to helping write the state guidelines that involve the Association of Addiction Medicine and state legislation in both Tennessee and Virginia, that is quite the climb.
It's been a road, and there's only one way to do it, of course, and that's one day at a time.
Yeah.
I was actually president of the Tennessee Society of Addiction Medicine for some time, and helped motivate that organization as well to advocate for people with addictive disorders.
Well said. Now, let's talk a little bit about the DEA and their involvement in all of this. And I know that some of it is still fresh, so please share what you feel comfortable in terms of the DEA's role, how they got involved, and what happened subsequently.
Well, back in 2010 and 11, buprenorphine practices were viewed askance by the Drug Enforcement Agency. And I had several conversations with leaders in the DEA office in Roanoke, Virginia, and they told me, quite frankly, that their mission was to shut down all of these treatment centers. We were harassed regularly by DEA agents coming in and nitpicking and saying that our doctors were over the limit. And we proffered our clinic to the Department of Justice. We said, you guys can come in, see anything you want, tell us what to do different, help us treat these people with addictive disorders. And the Department of Justice did not take us up on that offer. So as we expanded and as we grew, it was during the time when Jeff Sessions was given $1 billion and told, go do something about the opiate problem. And his solution was to go after people, after addiction doctors, and to go after people who were trying to do something about the problem. And once that momentum started, it was very difficult to stop. It's only been turned around in the last 3 or 4 years with the removal of the cap on the number of patients that an addiction doctor can see, which was always, to me, absolutely insane. Here you have a fatal illness, a chronic progressive fatal illness that is slowly, patiently waiting to kill you. You've got millions of people that do not have access to appropriate care. You have physicians who are willing and able to care for them, but you have the federal government saying, nope, you can only take care of 100 of these patients at a time. It was insane. And we actively went to Washington, D.C. and filed a petition with Secretary Burwell to change that number from 100. And we actually asked for 400, and the compromise was 275. And even that limit of 275 is now gone.
With the lifting of the X waiver.
The X waiver lifting eliminated that and opened it up for nurse practitioners and physician's assistants, which is the right answer. If everyone who had opiate use disorder in this country had access to buprenorphine, overdose death rates would drop in this country by 70%. And we look at the case of Portugal, which had an equally bad problem in the 90s, but instead of cracking down and doing vicious police state tactics against those who have a disease, they opened up the doors for treatment. And overdose death rates in Portugal dropped by 80% in the same time frame that in the United States they went up by 500%. Now, Portugal is a small country about the size of New Jersey, same population, and in the time frame that New Jersey had 3,000 overdose deaths, Portugal had 80, because they don't stigmatize people with addictive disorders. They embrace them. They encourage them to get treatment and care. They have open access to buprenorphine and methadone. I'm not a big fan of methadone. I think it's appropriate in certain cases, but buprenorphine is a phenomenally safe drug. And so I've been a political activist pushing for this, and I'm afraid that there were some people that weren't too happy about that. And as a result, we became a target for the Drug Enforcement Agency. And you want me to go on?
Sure.
In 2018, the DEA came into our offices. They raided 6 of our facilities, stormed in like stormtroopers, full SWAT gear, herded patients into one room, herded the doctors into other. And these are large 5,000 square foot medical facilities with group meeting rooms and psychologist offices and well-appointed meeting rooms for the patients. And they rounded everybody up. They took computers, they took people's cell phones, they terrorized our patients. And that was on May 2nd of 2018. We didn't know what to do. The business, we lost a tremendous number of patients, and I eventually had to bankrupt the business. And I sold it to a company that bought it out of bankruptcy and has kept it going, pretty much with the same model that we had established. But 3 years later, after 3 grand juries refused to indict me, a 4th grand jury indicted me on 42 conspiracy charges relating to prescribing and relating to lab work and Medicare and Medicaid fraud. And none of that was remotely true. And after 2 more years facing 840 years in prison and a $42 million fine, I accepted a plea. I pled guilty to 3 misdemeanors for misbranding, and this allowed the case to settle down. But the reason I took the hit was to protect the practice and protect the patients. That was always our concern, is that going after doctors who are treating addictive disorders is going after the patients. It's going after people with addictive disorders, and it resulted in deaths. We know it did.
Yeah.
It was tragic.
Thank you so much for sharing. As you know, I can relate to so much of what you just said. We both carry the distinction of being featured by Cato Institute for the way the DEA targeted our practices. So, in that vein, I share the pain that you went through. But what's very interesting about your case, and I think is worth highlighting, is that you were uniquely proactive in reaching out to the Department of Justice, to the DEA, to find collaborative solutions, to find a way to balance healthcare and health law. But they never really seemed to want to work with you. Can you talk a little bit about those initial engagements with the DEA and then how those engagements changed once they started investigating and subsequent to the indictment?
That is an interesting story. When we had the 100-patient rule, I called the DEA because they had already sent agents into our offices in several locations on several occasions and said, what is the exact number for this 100-patient rule? If one of our doctors sees a patient but goes on vacation, can another doctor see him? Can we cross cover? Is that 100 patients a month, 100 patients at a time? It was a law that was passed with no regs. And when you pass a law with no regulations, then there's nothing to define what's right or what's wrong or whether there's punishment for it or anything. And the DEA agents, the director of the Roanoke office of the DEA said on the phone, "What are you, stupid? You can't count to 100, 100 to 100. We can't keep track of you doctors going on vacation. 100 to 100, you got to keep track of that." I was appalled. I was totally stunned. And it was that same agent that later said, well, we're going to shut down all these Suboxone clinics. And addiction medicine was targeted. This was 2010 to 2015 as being part of the problem rather than part of the solution. And, I think evidence has turned in our favor, and it's quite evident now that people who get treated for opiate use disorder are much more likely to live and find their way perhaps into 12-step recovery or into faith-based recovery or rational recovery or some method to allow them to continue to live their lives without using opiates.
Yeah. Oftentimes, when a physician gets targeted in the way that you and I have both been targeted, there's a flurry of news headlines, a propaganda campaign, if you will. And oftentimes, physicians, members of the general community, are left to parse through where they'll say, well, you must have done this wrong. You probably didn't do this, but I'm sure you did this wrong, so on and so forth. From your standpoint, reaching the legislative and policy heights that you have, being known for your advocacy, and this happening on top of that, what was the community reaction? What were the reaction among your peers?
Among my peers, everyone's jaw dropped because we had established ourselves as the national standard of care of how to do outpatient buprenorphine properly. We had in-house groups, we had peer support specialists, we had psychology, we had everything that was later established as the American Society of Addiction Medicine guidelines. In fact, it was our guidelines that we sent up to ASAM headquarters that were used as a model. And likewise, for the Tennessee office-based opiate treatment program guidelines, the guidelines that we had established at Watauga Recovery Center were the ones that were used as a groundwork for building the Tennessee OBOT program. And so all of my peers and friends kept saying, oh, well, you're not going to go to prison. There's no way you're going to go to prison. You didn't do anything wrong. This is not possible. And what they don't realize is that once the government makes this decision to investigate, and they spend $1 million, or in my case, $2 million investigating the case, they can't just say, oh, sorry, got the wrong guy, and walk away from it. They just can't do that. They have to close out the case somehow. And when the federal government closes out 97% of all cases with plea agreements, and of those who go to trial, they win 98%, that's a higher percentage than in Soviet Russia or in communist China. So you don't go to trial. And unfortunately, I just had another friend of mine who got involved in a very similar case down in Central Tennessee, who got convicted of 8 charges, and he's going to do significant time. You know, um, so the rest of the community, like you said, well, if the federal government has investigated him, he must have done something wrong. Where there's smoke, there's fire. There must have been criminal activity. Not necessarily. No. No, you can do absolutely everything right by the book. We engaged legal teams out of Washington, D.C. to review our policies and procedures, to review our guidelines, to make sure we were OSHA compliant and HIPAA compliant. And we had documents, $100,000 worth of legal documents, to make sure we were in full compliance with every aspect of the federal government's law. And they came after us anyway. And there may be various reasons for that. There were definitely toes we were stepping on that were involved in the addiction industry, a lot of big money involved. But I don't have any hard proof of any of that. So it's all speculative
You know,
why that happened.
addiction medicine is particularly unique in that there's a lot of entities outside of traditional healthcare that seem to have some sort of influence, some sort of sway. At your level, I see a very distinct contrast. I see this advocacy, this rollout of just this high quality national standard model of care. And then I see this investigation that culminated in a plea, which is something I can relate to quite closely. Juxtapose the mindset in one world versus the other. What was going through your head as all of this was happening? Did you ever think, well, can I use some of my connections from the legislative or advocacy world to help these people understand what I'm doing? What was going on in your mind?
I was in a state of shock, and I was trying to keep my family together. I have 8 children. I had 3 of them in college at the time. I was able to find a job working in addiction medicine. In fact, I had active medical license up until June when I had back surgery. And that's when, after I was convicted of these misdemeanors, the state of Tennessee summarily revoked my medical license without a hearing. And that's what the Cato Institute article was about, Kevin MD. And reciprocally, Virginia then suspended my license, as did South Carolina. North Carolina, however, reviewed the case. Their board lawyer looked at the case and saw that I had been fully compliant with the Tennessee Medical Foundation Health Physicians Program for 19 years. And I was compliant with North Carolina Physicians Health Program. And they made the decision to not take any specific action on my license. They did suspend it, but they stayed the suspension pending the completion of my compliance with the federal government's rules. And so I actually went to prison with an active North Carolina medical license. And I am now back in practice with a small practice in Asheville, which I hope to expand.
That's interesting. You and I are kindred spirits in the sense that we both went away and now have active medical licenses looking to rebuild practices. I can definitely tell you what it's like on my end, but I'm curious to see from your end, what is it like seeing patients again? What is it like being back in that position, knowing what you went through, knowing that the patient knows what you went through?
Well, the patients knew me well before I went down. And so they were more than happy to see me come out and are all excited that I'm back in practice, maybe opening up a new office over in the Asheville area. And a lot of the patients that had left and gone other places will be flocking back. They'll go, oh, Dr. Reach is back. Dr. Reach is back in practice. And they'll be back. But we'll see what happens with Tennessee. We have appealed that revocation, and that has gone from Chancery Court to the Appeals Court, and is now pending in the Tennessee Supreme Court based on a lack of due process.
Wow.
We have strong advocacy with the Tennessee Medical Foundation. The Tennessee Medical Association is backing my position in this case, as are some members of the Tennessee Board of Medicine who were obligated to revoke my license based on this McNally law, which was passed during the heat of COVID and was opposed by the TMA at that time. So without wanting to do anything to mess up that specific case, let's just say that it's active and it's going to be heard in the near future.
Wow, that's amazing. How were you able to maintain the strong clinical network? I know personally, and many other physicians that I speak to, that when something like this happens, the network just vanishes. But in your case, you're able to maintain those relations, or at least to a certain degree. Can you talk about how it's like to maintain those relationships?
Yeah, it was. When you're doing good work and doing the best you can to try to help people to the best of your ability, you attract a certain kind of person around you. Now, those who turned their backs on me and walked away were never really my friends. And those who stood beside me are anxiously awaiting to see if I get my Tennessee license back so they can offer me employment. So, personal relationships, personal networking, that's what put it together. And of course, there are those who were terrified of the federal government or having their name besmirched, and they dropped off like flies.
Internally, just the swirl of emotions that are going on must have been overwhelming. As you had mentioned, you said you were in a state of shock. How was it like just going day by day, reaching out to, physicians of a certain stature, from the Medical Licensing Board, from the Tennessee Medical Society, while dealing with this emotional swirl that's going on in your head?
Well, the emotional swirl is pretty much gone. I didn't mention that I just spent 6 months in a federal prison as part of the plea agreement, and that was one of the best things that could have happened to me, uh, except for the difficulty it placed upon my wife. Um, I was up at 5:30 every morning. I walked over 1,400 miles on the track on the edge of the New River Gorge. I wrote 2 books while I was in prison, and I lost almost 60 pounds.
Well,
So for me, it was a glorious experience. I don't recommend it, um, but a lot of people use it as the retirement plan. The food was horrific. The people were excellent.
that's interesting. So now, moving forward, do you ever feel like there would be additional retaliatory actions against you now that you're trying to rebuild your practice?
Well, I would certainly hope not. Um, for them to have come at me with 42 felonies and dropped it to 3 misdemeanors, there wasn't a lot there. The IRS came in and ripped our books apart, no tax fraud. They thought we had millions of dollars stashed away in Mexico. There was no money missing. Every nickel was accounted for. Over the course of the 8 years that we were open, we gave away over $1 million worth of free medical care to the people in the Tri-Cities area.
Well,
We also provided free services for the pregnant women who were locked up in Washington County detention. We would bring them to our office. We would see them free of charge. We would make sure they get their medication so that their babies wouldn't be going through the tragedy of withdrawal should the mother withdraw while they were in prison. And we had community outreach into all of the community, as well as all of the political activism down in Nashville and Richmond.
all of this just kind of begs credulity of
It's
all the physicians.
Kafkaesque, isn't it? It's Kafkaesque. Have you ever read The Trial by
I did.
Kafka?
In fact, I read it in prison.
My son put me onto it after I got out.
Yeah.
I've been enjoying it for sure.
Yeah, I know. Kafka is definitely a great author to read in times like this.
Yes, yes, yes.
What advice would you have to physicians who may see a colleague going through something like this and then make the decision, should I cut off ties? Should I do what I can do to help, knowing I may be targeted myself? From your vantage point, it's just incredible to see your resiliency. But I'm sure you've had some level of empathy for those around you who may have either walked away or tried to support you. For that particular individual who's in the position to say, should I support or should I walk away? What what feedback, what words of advice would you have for that individual?
Uh, Associating with somebody who's going through this kind of thing is not in any way going to mark you. A federal investigation takes a lot of time, energy, and money. And they're not going to rope somebody else in unless they're involved in some nefarious scheme. Um, so I would say to embrace those people who are going through this trial. I had the benefit of an excellent support group. When you're active in 12-step recovery for over 20 years, you make a lot of friends. And very active in the Tennessee Medical Foundation Physicians Health Program, helping physicians, impaired physicians or physicians with issues, uh, get into recovery, stay in recovery, support them in recovery. So I had a huge number of people that rallied around me. I was very fortunate in that.
Interesting.
Not to mention my stalwart wife, who stood strong through thick and thin, and my family, my kids.
Yeah. That experience, did it ever lead you to question whether your marriage would dissolve or that those personal relationships would strain? Talk about some of the personal hits and struggles you faced as you're going through this really difficult professional journey.
It was really tough. There were people who definitely wanted to distance themselves from me, and uh, I'm at this place in my life where I let them go and said, well, there's that. And then there's those who stood strong, and everyone around me, my mother, my best friends, my wife, my family, everyone suffered. And in fact, many of them suffered far more than I did. I have the support group, I have the fellowship, I have a spiritual program. And so I had something to fall back on. Um, I meditate for an hour a day.
Wow.
Yeah.
Let's talk a little bit about a few things you had mentioned at the very beginning that you had alluded to throughout the conversation. You'd mentioned that you yourself had a substance dependency that you've successfully managed to address for many years and has led to a very successful career prior to the DEA and perhaps will lead to an even more successful career subsequent to the DEA actions. How does that help build empathy with patients?
There's two kind of addiction doctors, those who have been there and those who haven't. For people who go into addiction medicine the way you would go into endocrinology or go into neurology, addiction is a scientific model that you follow certain rules, you get certain outcomes. Classic clinical medicine. For people who are in recovery, the therapeutic value of one addict helping another is without parallel. And when the patient knows that you've been there, you connect with them much better. They're much more likely to listen to you, and they're more likely to succeed. I was addicted to the needle, and I lost everything I had. I ended up in Mexico on the run, woke up on the floor of a bed and breakfast laying in my own vomit. Was 167 pounds, covered black and blue with track marks. And there was an old man there. I thought he was old. He was kicking me in the butt, going, hey, you, are you done? And I kind of looked up and I said, I think I'm done. He goes, well, that's good. The only English speaking 12-step meeting for our 400 miles is meeting tonight in this bed and breakfast. Are you coming? I said, I think I'm coming. And I got clean and sober in Mexico, going to 12-step meetings. And I've never looked back.
Wow.
Yeah. It's a program that works. And the reason it works is because you're going through a systematic program of neural repatterning. Addiction is a brain disease. Chronic dopamine reward deficiency syndrome. You don't have enough dopamine, you feel like crap, you take opiates, you feel better. A normal person takes an opiate, they go home and go to bed. I took an opiate, I would go home and clean the garage. I feel normal. And you set a pattern of behavior in your brain that says that in order to cope, in order to handle life, you have to have a substance. And so you need to change that neural network through a process of neural repatterning and neural snipping. And that's what I've been teaching now for over almost 20 years.
So now that you're back in practice, are you going to treat patients with substance dependency again, or are you going to steer clear?
No, I am back in practice treating people with buprenorphine for opiate use disorder. Yeah, I treat people with alcohol use disorder. I taper people off of benzodiazepines. I'm not a fan, but any addictive disorder.
So what's so interesting about that is I'm sure you've had all the colleagues that you could imagine come and tell you you're back in practice. Great. Stay away from substance dependency. Please go into something else. First off, talk about those experiences and then talk about your decision to say, you know what? I'm going back to what I was doing.
Yeah, there was never any question that I was going to go back to what I'm doing. I don't do addiction medicine for profit. I don't do addiction medicine for prestige. I do addiction medicine because it's my calling. That we only keep what we have by giving it away. And there are, hardcore 12-step people that say you shouldn't be using medication assisted therapy. Well, you can't get into a meeting and you can't get the program if you're dead.
Yeah.
And buprenorphine is phenomenally safe. You can't overdose on it. There's very little euphoric effect from it. And you don't escalate the doses. And it's the best solution right now at this time for opiate use disorder. And this fentanyl crisis that we've seen, I mean, they took me down in 2018. It's 2024. It's an exponential curve. When I went in, we had just passed overdose deaths exceeding car wrecks at about 70,000. And I think we're now up to 130,000.
Oh, yeah.
It's shocking. It's shocking. And meanwhile, like I said, in Portugal, overdose deaths have dropped 80% because they have access to care.
Yeah.
You got to treat these people. What are they trying to do? Kill these people?
Let's talk a little bit about your views at a policy level, particularly going through what you've gone through at a very intimate level. You experience substance dependency. You treated substance dependency. You've seen the ramifications of misguided policy on substance use dependency. How do you integrate all of that together? Is the DEA responsible for the fentanyl surge, or is it more complex than that?
This goes way back. I mean, we go back to Harry Anslinger and the original, prohibition. And when alcohol was made legal, they had to find some other target in order to keep their agency open. And so they went after marijuana, and that eventually developed into the DEA and this war on drugs. Uh, and it's been a failed model. It's been a failed model for decades. And everybody in the world and everybody in this country can see it and realize that it's a failed model. The solution for substance use disorder is to treat the addict. You treat the disease with appropriate medication. Well, that's just replacing one drug for another. Let me tell you a short story. All right. Mary was a patient of mine. She was a streetwalker in Johnson City. She lived at Salvation Army, and she comes in covered black and blue with track marks. And we start her on buprenorphine, and a week later, she's looking a little better, got some color in her eyes, sees my wife, Maggie, who's doing the counseling. And a month later, she's coming back, and she's got a little Sprite, and she's moved into Section 8 housing. 3 months after that, she's got a job at McDonald's. And a few months after that, she has a car. And then she comes in and wants me to sign a paper so she can get custody of her kids. And a year later, she comes in, makeup on, dressed to the hilt, pumps on, holding up her GED. Dr. Reach, I got my GED. I'm going to college. Now, have we just replaced one drug for another? Or have we treated the disease of opiate addiction with appropriate medication? That's what I've got to ask you. These people on buprenorphine, they work, they pay their taxes, they pay their child support, they stop doing crimes, they're not having to steal, they're not having to rob. If we treated all of the addicts, what would the DEA do? Why is there a flood of fentanyl? We were on the rooftops in Nashville in 2017 saying fentanyl is coming, fentanyl is coming. You guys better get ready for this. I was one of the first doctors to sign a statewide prescription for anyone to go into a pharmacy and pick up naloxone with one of the major pharmacy chains. I mean, we were out there screaming it, and then they brought me down. And here we are today. People are dropping like flies.
We hear this from so many physicians. We hear this from so many advocates, patient advocates, those with lived experiences. But it just keeps continuing. Why either
Well, do you want to speculate on conspiracy theories?
well, that's almost the realm that we're going to, right? We kind of get to a point where we see this massive contradiction, and we can't help but go into the realm of speculation. What other option do we have?
I go back and reiterate what I said. If we treated all of the people with substance use disorder, what would the DEA do?
Yeah,
And so they don't really want people to get better.
I know.
Now, there's been a change in the Drug Enforcement Agency in the last 2 years or 3 years. They're doing educational meetings. They're actively promoting and supporting medication-assisted therapy, which is complete contradiction to what we were facing just 8 or 9 years ago. So I think that there has been some awakening, and I think it's probably come from the top down. But yeah, it really makes you wonder. It really makes you wonder. What's killing people? Drugs coming across the border, fentanyl. Who is the DEA going after? Doctors. Why? Well, the guys coming across the border, they don't, have a lot of money that's easily obtainable in U.S. banks, and they have a lot of guns. Doctors, 87-year-old doctors, 74-year-old doctors sitting in their offices, they've got their retirement funds, they've got plenty of money, and they've got no way to defend themselves. But
Yeah,
that's speculative.
it is speculative. To kind of round out what you just mentioned, the DEA is not a self-sustaining organization. They run a deficit, so they require a certain amount of civil asset forfeiture that they can then use to help maintain the organization itself. Whether that is the impetus for why they behave the way that they do, we don't know. We're acknowledging that it is speculation and that there's no hard proof either way. But boy, I tell you, you see enough of these physician cases, you see enough of this going on that it's quite curious, to say the least.
There are thousands of physicians that are locked up in federal prisons right now, mostly in federal prison camps. These doctors are trained. If they really did something wrong, let them go work on the reservations. Put them with Doctors Without Borders. Let them go into the Peace Corps. Allow them to serve their time giving back to the community, if indeed they have done something criminal or something wrong. But it cost over $1 million, public money, to train a single physician. And when you take a physician out of practice and lock them in a federal prison, not only have you lost that $1 million investment, now you're having to pay $43,000 a year to feed him and wash his clothes and keep him alive.
Yeah.
It's absolute insanity.
Yeah.
It's completely crazy. Now, sure, if you have a physician that is going to the McDonald's and trading cash for prescriptions, all right, that's criminal activity. If you have a physician who's trading sexual favors for prescriptions, sure, that's criminal activity and should be dealt with and dealt with properly. But for doctors who are seeing patients in their office, recording documentation, charting, doing physical exams, and writing legitimate prescriptions, it's unthinkable that the DEA is targeting these individuals, and you have to ask why.
Yeah.
That's not where the problem is. The problem is on the border. The problem is pounds of fentanyl, kilos, tons of methamphetamine flooding across the border. That's the problem.
Hopefully, podcasts like us and podcasts like this one and other stories can really help to shed light, because, as you know, the power of the narrative is much more impactful than any data point or any number could suggest.
That's
In the
true.
remaining time that we have, Can you give a few words of wisdom on your state of mind, your resiliency, and just what it makes you tick so that you can go through what you've gone through, yet still remain as optimistic and as committed to patients as you are?
I know that we did absolutely everything within our power to do everything by the book, and we were prosecuted anyway. So therefore, my conscience is clear. Um, as I mentioned, I have a very solid spiritual program. I attend church on a regular basis. I attend meditation on a regular basis. And I have solid friends and family that have supported me and backed me. And my mission and my calling, the reason I was left alive when I woke up on the floor of that bed and breakfast was so that I could carry the message to the alcoholic and addict who still suffer. And that's my primary purpose. Utilizing my medical skills to do so is just another tool. If I lost my license tomorrow, I would still be carrying the message of recovery to those who still suffer.
Yeah.
And I think that is the strength. And the science behind it is that I've reprogrammed and rewired my brain to the point that it never crosses my mind to use drugs or to take drink.
Yeah.
Although you never know when it's going to come back and bite you in the butt. So that's why we keep going to meetings. People that go to meetings get better. People that don't go to meetings don't ever get it.
Well said, Dr. Reach. Thank you so much for your time and look forward to continuing the conversation.
Absolutely. Thank you so much. Take good care.